Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, and you come up with the same old stuff. Nothing that really works permanently. Well, here's an opportunity. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you. Let's kind of tiptoe the weeds, so to speak, your health weeds, and see what we can do to make a difference and put you in a direction that you hadn't thought about. Remember that anything that happens to you, regardless of what the symptomological complaint is or the pathology that you have, had to come from one of three different things. You either hurt, injured, so you affect your nervous system and your muscular system. You have not eaten the way you should. You know, things that you put in your mouth that shouldn't be there, things that you need more of, you don't get enough of, are exposures. Electromagnetic problems. You know, we're in a cesspool, particularly living in metropolitan areas. Those of us who live in the Washington metropolitan area, you're bombarded constantly by all kinds of things, from low-volt electromagnetic fields to microwaves. And the third is emotional stress. You know, the body doesn't know the difference between an actual experience and something that you think about. The effect is absolutely, positively the same. I want to talk to you about several things today. It's a couple of things that are in the news and a couple of things that you need to know about. We're going to talk about fats and heart disease and cardiovascular disease and shine some light on some things that you were told but really aren't the truth. And that's the problem. You know, who do you believe? You know, what do you have to really understand to make a difference? There was an article recently that I was talking about. We'll get more into it as the program goes on, and that, you know, everybody's been told that cholesterol is not a good thing and that blood pressure is not a good thing. There's more and more definitive science out there today that says that as we get older, we should have more levels of cholesterol. There's more and more science that says that a little increase in blood pressure, as long as it's within certain parameters, and the bottom cholesterol or bottom blood pressure, you know, the downside, when somebody says 125/72, when that lower side is low, the upper side might tend to be a little higher based on traditional medical models, but they're really not that high. See, what happens is that things change and shift over a period of many years. And they do that, unfortunately, sometimes because the parameters are being paid for, in my opinion. The research is being funded by those who have a vested interest in you taking medications. Now, am I really going to go slam Big Pharma again? Well, probably. I mean, that's one of my favorite subjects, because I want you to understand the manipulation that goes on in the marketplace. At the end of the day, it's you being your own personal advocate relative to the things that you need to know about. That's why I do this program. That's why we do Dr. Tom Roselle Live. That's why I'm on the platform and away from home and doing all those things that are important. They're important for you. You know, I read an article. We're going to get into some other things, but this kind of tweaked me the other day. I have patients that come into the office and they tell me, I sweat too much. You know, I can't stop from sweating. And when I look at them in most situations, and I usually say, well, good for you. You should be sweating. Sweat is important. You know, and there's different odors with sweat, and they tell you different things about the body. But the bottom line is that you need to sweat. And like it or not, you can't live without sweating. You know, perspiration, you know, that stuff, that drippy, misty stuff that comes off your body, protects you from overheating and just blowing all your circuits out. Yeah, you're like a computer. If you get too hot, you're going to shut down. So when your internal temperature rises significantly above 98.6 and stays there, there's this little thermostat. It's called the hypothalamus. It's in your brain. And that hypothalamus is kind of a temperature regulator. And it signals your internal system when you get a little too hot to start sweating. And then perspiration comes up to the skin and it gets to the pores. And what's supposed to happen, it's supposed to evaporate when it hits the air. And that evaporation, if you want to know the term of that, by the way, is called counter-current heat exchange. That evaporation keeps you cool. So when we sweat, during exercise, and, that's the right thing to do, but other things prompt sweating, like, a hot summer day or situations that make us feel real anxious or embarrassed or upset or mad or, all those things can stimulate the sweating mechanism. So, what is this sweat? What is it? It's small amounts of, release of fat and water and, electrolytes like sodium and potassium and calcium. If you sweat too much, you set up a tremendous imbalance in your sodium and your potassium and your calcium. And it differs, depending on which kind of sweat gland it comes out of. And there's actually two that are really important. One's called an Eccrine and the other one is Apocrine. And I know they're fancy words and, some crazy scientist, physiologist named them that way, but they're really named because of the stuff that they do. The Eccrine glands are found all over the body but are mostly concentrated in our foreheads and our palms of our hands and our soles of our feet. And, so these glands produce, generally it's a clear, watery fluid. And, they kind of get out there when you're exercising, right? And those are the first areas that begin to get hot, and then you start sweating in place. So the bottom line is don't blame these glands. When you say, God, you stink, like your teenage son comes in and he smells, or your grandson or your granddaughter or whatever. Well, don't blame the eccrine glands, okay? This type of perspiration doesn't smell at all. If your feet are stinky, you say, oh my God, get those feet away from me type of thing. They're due to an overgrowth of other things, and it can be mold and fungus. It also can be bacteria. And you got to remember, your feet are enclosed in shoes, and they're enclosed in socks, and all these things kind of build up over time. So the other glands that we talked about are these apocrine glands. On the other hand, they produce this milky fluid. This that leaves a residue on your body, and that's the one that's responsible for the stink. Yes, that's why we stink, and that's why our kids stink. They're found primarily in the areas in our hair follicles and underneath our arms and our genital areas and so forth. And the apocrine, sweat doesn't innately smell. It's not supposed to smell, but it interacts with all these bacterial organisms, like Staphylococcus, and that live on your skin. But it even goes further than that. These apocrine glands are an external representation of the garbage that you have inside of you. If you're toxic, these are the guys that get rid of the junk. And your skin is an organ of elimination through your sweat glands, but also just through pushing through the skin structures and so forth. And that's a subject that we could get into, but we don't have the time to do it today, so we're not going to. So I want you to understand that the more toxic you are, the more you're going to stink. The more fungus and mold that you have in your body, the more that you're going to stink. The more bacteria that lives within you and, the acne that kids have, the more you're going to stink. So if you don't want a stinky body, you've got to make sure that you change what it is that you put in your system and make sure that you have a clearing process that gets rid of this stuff. Unfortunately, when we eat the foods that we eat and we put the abundance of sugars in our body, all these areas begin to produce mold and fungus and bacteria and so forth. And then when we sweat, guess what? That's the deal. We have all this stuff. So, then people say, well, I'm older now and, I smell differently. Well, there's a reason that little babies and little kids smell sweet. We love the smell of a little baby, right? It's like, oh, it smells so good, right? Well, their apocrine glands aren't active yet. When does it hit? Yeah, stinky puberty. It's when, your teenage kid or granddaughter or grandson or whatever starts going through that change of life, and oh my God. I mean, it's like, if you have a child, if you've ever gone through that process, you want to isolate them. You want to put these, the old stick-ups in their closet so you can't smell them, and don't let them in the house until they're showered someplace else. That's the process of transition. Those are hormonal smells that you get. Another shift happens about midlife, and about 75%, I'm sorry, ladies, women, you experience, hot flashes, and you soak your bed, and you're going through perimenopause and menopause stage. Unfortunately, more dramatic in this country, in Western civilization, than in places like Asia and other parts of the world, because they take better care of themselves and their dietary patterns are more supportive. So what you're getting is an external representation, an external smell of all the things that have accumulated over a period of time. And again, we need to get into that, but we won't on this program. The central thermostat of the body, malfunctions. That hypothalamus that we talked about, we lovingly call this, there's a circuit, it's called HPA axis, hypothalamus, pituitary, adrenal. And if it's not working properly, then our whole endocrine system is off and our whole hormonal system shifts. And subsequently, you get into what I call personal summers, and you go into this problem, and, you have that kind of situation that goes on all the time. So sweat is important. You must sweat. Those of you who don't sweat can be in big trouble because you can't get rid of toxin and you can't keep your body cool. So you have to make sure that, you clear your system out. So let's just talk about one little piece, that cooling mechanism that you're supposed to protect yourself from. See, when you use all this underarm dope, you stop yourself from sweating. It's not okay. It's not a good thing. Because, first of all, if you're smelling, then it means that you're toxic. You shouldn't smell badly. You shouldn't be socially unacceptable to somebody else's nose. And so that means that your body isn't doing what it's supposed to do. So, if you're sweating, it's supposed to get rid of toxin, but also is to cool the thermostat down. But guess what? If you don't expose your body to air and humidity, it makes it very difficult because it suppresses the body's ability to regulate that counter-current heat exchange. Okay, enough of sweating. 888-630-9625. That's 888-630-9625. Have a lot of things to talk to you about today, and we're also going to go to the phones. Anne, how can I help you? Thank you for calling.
Yes. Hi, Dr. Roselle. I enjoy your show very much on Sundays.
Thank you.
About 2 or 3 weeks ago, I woke up and my left ankle was hurting. After I got up, moved around, showered, dressed, it's fine. I didn't even realize I had it. Then this past week, it didn't go away. And it seems to be radiating at first from, what is that, the tibia or the fibia? That's the bone to the left of the knee. And that's very sore, very, very sore. Yesterday and today, it's coming from almost up to the top of the leg, all the way down to my ankle. Walking is difficult, and standing is almost impossible.
Okay, let me ask you a couple quick questions. The foot, ankle, knee, leg mechanism is a very integrated piece of machinery, and so subsequently you have muscles that move bones, and just taking the foot by itself, you have, like your hands, you have all these long bones that are, part of the distal portion of the foot, and then you have bones that come up. You have a wedge or bone called the talus, and then behind that in front of that you have cuneiform bones. You have a heel bone called the calcaneus, but you have muscles that come from the leg and they go all the way into the foot. They cause your toes to come up towards you. They keep the foot stable laterally and so forth. So as you're looking at or looking at your legs, the medial bones, the big ones, you got two of them down there. One's called the tibia, the outside, you got a little bone, long bone, probably the size of your thumb, called the fibula, and they have to stay in normal approximation, and there's nerves that flow through that. And Anne, we're coming up to a break, but I want you to hold on because it's kind of an interesting mechanism, and I want you to understand that. I have an idea of what's going on with you, but I've got to ask you a couple questions. So stay put. Don't get off the line. I'll be right back. You're listening to Dr. Tom Roselle. Don't go away. You've been everywhere, you've done everything, and you still feel like, Did you know that your health and wellness starts with your brain and nervous system? What if by establishing normal brain and nervous system function, you could regain your energy, strength, and vitality? Would you be interested? I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me and an elite group of wellness practitioners for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that could change your life forever. A day when you'll learn step by step how to create a brain-body connection that will allow you to live in a state of wellness that you deserve. Register today at agelesshealth2015.com. That's agelesshealth2015.com. Or call 703-698-7117. Register today. After all, your health is a do-it-yourself program. Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Indeed, I'm in studio. Give me a call, 888-630-9625. That's 888-630-9625. I want to remind you, if you'd like to reach us when we're not on the air, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. Or go to drtomroselle.com. That's DRTOMROSELLE.com, and send me a note, and we will make sure that we get back to you. We either write you, or if you need to talk to somebody, give us a call at the Roselle Center for Healing, 703-698-7117. And you're still holding?
Yes, I am.
Okay, let's talk about it a little bit. So you got this foot pain, and at first it went away, and then it didn't go away. And so what you have to look at is the mechanical platform that the foot is based on. So we're looking at structure that has to be in balance, one foot opposed to the other. The foot can't be pronated, it can't be supinated. And when you think about those two terms, one means supinate means like a cup of soup is turned, so it's looking that way, and the other one is you're flat-footed. So here's the deal. So when you have this mechanical structure, these two long bones that come down, the tibia and the fibula, and then the next structure that it meets is going to be the calcaneus or the heel bone, and then just in front of that is the talus. If those two bones aren't aligned simply because they've been off-centered, because you turn your foot or whatever, then mechanically over time as the body begins to disrupt itself, it can cause the type of pain you're describing. Another very common problem is that long bone that I said that's to the outside, the skinnier of the two, not the tibia, but the fibula. Mm-hmm. The proximal portion near the knee often will go lateral, and it will go posterior to the back side. There's a nerve that comes out of there, just for sake of naming it. It's called the common peroneal nerve, and it goes down and it attaches to several structures, but one is the muscle called the tibialis anterior muscle. So the reason it's called that is because it's next to the tibia bone, but it goes into the foot and it holds your foot up. And if that nerve is irritated because of displacement of those bones for one reason or the other, then that muscle's not going to work and the foot's going to drop down. And when it does that, the other structures of the foot now begin to deviate. So it's fixable. It's just that you got to, get to somebody like me or whatever. It has to be manually manipulated. But you also have to check not the foot only, but the foot and the bones and those long bones and the knee and the muscle. See, remember, all the nerves that go into that leg and that lower portion of your foot and so forth start in the low back. So if there's any disrelationship, any imbalance, any what we call in chiropractic subluxation, the osteopaths call it a spinal lesion, if there's any millimetric off-centering of the pelvis or that low back, that can affect all those things too. So you check them all the way through. You find the cause, it's fixable. So I hope that's
that's been helpful. The only thing is, if you're in Virginia, that's like another country.
Well, everybody has a problem going across. I know everybody has a problem going across that Legion Bridge, and I'm not sure why. You got to be able to come across it. It's not that bad. I come up from Virginia to do the radio program, and up in this area, so it can be done. No, and there's some people that are around, but the thing is that can be taken care of, and you really need to pay attention to it. John, calling from Strasburg, Virginia. Thank you for calling. How can I help you, sir?
How you doing today?
What's going on, my friend?
Well, I heard you talking about sweating, and it instantly brought myself to mind. I've always been a pretty heavy sweater, but it seems even worse in my older years. I'm 43. And it seems like the last 5 or 6 years, the smell of it has gotten worse. And I'm a pretty bad night sweater.
Okay.
And course, you know what that does to the sheets and such.
Yep.
But recently, my wife and I have gotten more into an exercise and diet program, and also I've quit smoking. I'm on 3 weeks and 2 days now not smoking.
Congratulations, buddy. I appreciate it.
Thank you. Appreciate that. I am vaping, but it's been a big help, but that's for sure. But anyway, I'm wondering, any of those single things or a combination of them, would that have any effect on the sweat or how it smells? And
yeah, let me give you a couple quick guidelines. You're 43. And you're going through night sweats. That means you're going through the same thing that women go through in menopause. You're going through something called andropause, and it's male menopause. You shouldn't have to do that, but it does tell me that your endocrine system is imbalanced. So, we'd have to go and we look at the fight-flight system, you look at the adrenal system, you look at liver toxicity. The fact that you were a smoker tells me that you're going to put significant irritation on your body. If your diet hasn't been good, I'm just going to give you a mantra, things that I tell people to stay away from, just generally broad brush: sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO foods, and so forth. All these things are going to disrupt your normal body's function and cause you to be toxic, right? If you're not a water drinker, meaning that you should be drinking close to an ounce of water for every 2 pounds of body weight, then toxin builds up in your system. If you're a coffee drinker, you're dehydrated. If you're a soda drinker, you're polluting your body. So all these things are part of the puzzle, and you need to begin to eliminate those things, continue your workout process, but also it has to be supported nutritionally. If you were in our practice, we would be looking at your energetic fields, we'd be looking at your nervous system, we'd look at your biochemistry. All those things make a difference. But John, having said that, make sure that your diet is heavy in clean proteins and tons of vegetables every day, and stay away from grain. Anything that makes a cow or a pig fat, you don't want in your body whatsoever. Try to stay away from those completely. If I can help you, give us a jingle or go to our website, send me a note, drtomroselle.com. We're coming up for a break. Don't go away. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. 888-630-9625. That's 888-630-9625. That's how you find us here and how you find me when I'm not here. drtomroselle.com, drtomroselle.com. And do that. I mean, we're happy to communicate with you. If you need to talk to one of my staff, you can call us at 703-698-7117. Just tell my reception that that's, what your problem is and that you'd like to talk to one of our professional staff, and they will get back to you on whatever problem that you may have. We're here to help you. We're here to do whatever we possibly can. Unfortunately, the program's way too short and we can't answer everything as in depth as we'd like to, but we do our best. And, we try to post, and go to our website, by the way, rosellecare.com. That's ROSELLECARE, or drtomroselle.com. And there's plenty there to educate you. And, when you see things that say, wow, I didn't know that was there, just remember we do that for you. Bernice, my dear friend from Arizona, how are you?
Oh, fine. Good morning.
Good morning.
Good afternoon for you.
It is indeed.
I have a question. I have floaters about 4 or 5 years already, and I was wondering, is there any way to get rid of them?
Well, most of us at some point of our life are going to have floaters. And, surgery is often considered the only viable option to floaters. They do it today with laser and so forth. Most of us live with little floaters that we get used to, and we don't even notice them unless we look up against something that is a clear white background, and then all of a sudden, you see them. And so the bottom line is that anything that helps the eye sustain its normal integrity, such as vitamin A, particularly beta-carotene, is extremely important. Eating berries, the darker, the bluer, the better. And the xanthines in there are things that are very tissue protective to the body. So you can do a lot of things in a natural format as well. When they're very, very severe, obviously you need to have them looked at to get a professional opinion on them. If they're obstructive, where they're starting to cause some significant problems in your eyes, it's a whole different story, and you need to really be aware that those are not okay. All of us should have an ophthalmological examination on a fairly regular basis. There's the sac that causes the eyeball to maintain its shape. It's called the Vitreous Sac. And sometimes as that begins to drop down, we think that that's a floater. It kind of looks like cellophane getting all crinkled up. And sometimes it's very little, but when it's heavy, then it's not a floater. But that'll drop to the bottom of the eye as well. So first, get an examination. Make sure that there's nothing more than just some floaters going on. If they're really severe and they're bothering you, they're obstructing your vision, then in today's world, you're going to do laser surgery to get rid of them. But in the meantime, I would dramatically increase your levels of those two things. You can take, 5,000 milligrams or units of beta-carotene without any trouble whatsoever. I put patients on a lot more than that, but I'm watching them, and I do it for a very specific reason. Straight vitamin A is fat-soluble, so you have to be careful with liver function. But if you like blueberries and blackberries and so forth, those are great, to put in your bilberry is another one that is really good. So put those in your diet, increase your vitamin A. Zinc, by the way, is another one that will also help and protect eye function. So there's a lot of different things that can come into play. But first, start with a good examination, okay?
Yeah, I had some fluid that leaked into, I guess, my retina or something. I had a little hole or something, and I used to see a flash of light, and then after that is when I got the floaters. Have you had
your eyes checked since?
You know what? I did go. This happened like 5 years ago, and I did go like for 2 years, and then I haven't gone since.
Okay, so do me a favor. Go get your eyes checked.
Okay.
Okay.
I have really good vision. It's just that I see these little floaters,
Yeah, anytime that you've had any kind of retinal problem, just remember, if your retina gets damaged, you're going to lose your eyesight.
Okay,
and
so how could I thicken the retina or so it won't ever...
Well, first of all, it may have healed, and if they did what they did and it's healed up, then you really have no problem whatsoever. But in my brain, if it was my eyes, you've had it checked a couple years after the fact. Now you're about 5 years out. Go have it checked one more time and just make sure everything's in good shape so you don't have to worry about it. If it's in good shape, not an issue. Let me know that. Send me a note, and then I'll tell you what the next steps are. Okay?
Okay. Let me ask you a question. My daughter had a retina when she was 18. She's 26 now. A retina that detached, and the only symptom she had was she thought that she needed glasses. She like some people say they can't see at all when their retina detaches.
Well,
she could see, but it was like she just thought her vision was blurrier.
Yeah, Bernice, one of the first symptoms of a retinal problem is when you start seeing little sparkles, or you see something that looks like a shade in front of your eyes. That's the first indicator. And sometimes if the eye suddenly gets cloudy for no reason whatsoever, it's not a slow progression. It's like almost sudden it's there. That's retinal. It can be cataract if it's slow and progressive, and all of a sudden you need more light on the subject and so forth. That's indicative of cataracts. But the other elements that we just talked about are warning signs. Those are things that get your attention. You need to really pay attention to it.
How about bilberry? Is that something I should take?
Yeah, I just mentioned that. Bilberry is really great for night vision as well. They used to put that in muffins for aviators in World War II. It would help them with night vision as they were going on bombing raids.
How much a day?
It depends on the person and what other sources that you're getting. But, you can take easily 100 milligrams without any problem whatsoever, sometimes a little bit more than that. But check it out. Let me know what the status is, Bernice. And, but please don't neglect your eyes. 888-630-9625. That's 888-630-9625. Let's talk about your things. I want to remind you, coming up, I would be negligent if I didn't draw your attention to this. October 17th, coming up in about 2.5 months, right? What's that? That's a Saturday, and it's our Ageless Health seminar. It's the day that we teach you how to put it all together. This year is called the Brain-Body Connection. We're going to teach you how the nervous system, starting with your brain, affects everything from immune function to your capacity to be, your hormone system, how you're being bombarded, how your brain is being destroyed, why we're seeing an increase in dementia and Alzheimer's and Parkinson's and all those things. But more importantly, what you can do to stop that. Those of you who've been to this program before know that it is beyond a home run. There is so much data, so much information, and you don't want to miss this program. Truthfully, you do not want to let another year go by if you haven't been there. You will walk away with significance and certainty in the ability to change your life. Go to agelesshealth2015.com. That's agelesshealth2015.com, or simply go to rosellecare.com. That's ROSELLECARE.com, and register for today. It's at the Fairview Park Marriott Hotel in Falls Church, Virginia. It's a great place. We've had it there almost every year. We've been a couple other places years ago, but we keep going back there because it is a perfect location. It is calm, it's peaceful, it's beautiful, but it adds to the ambiance of what we're going to try to give to you because you deserve it. You need to be there. Ageless Health 2015. Do not let another day go by. The brain-body connection. This is an incredible opportunity. Do it today. 888-630-9625. Talked to you a little bit when we first started the program today that there's some misconceptions out in the marketplace today. And, for years and years, scientists and doctors and all these talking heads say that low-fat diets are the way you needed to go to make sure that you didn't get a heart attack, and that we had to make sure that we kept all these different types of fats out of your body, and cholesterol is a bad guy and it shouldn't be in your system and so forth. Well, that was ill-advised. That was not a good thing. Actually, it's the reverse. When your fat levels go down, your risk for heart disease and cardiovascular disease and cerebral disease goes through the ceiling. 15 years ago, when applying for any kind of insurance, they used to say high cholesterol levels as being a problem. You know what? If you really talk to insurance companies, they know that that's not to be the truth. There's one blood fat that is a flag, and that's something called triglycerides. And when your triglycerides are high, that's usually an indication that there are other things that are not working the way they're supposed to. See, the problem with cholesterol is that you need it. Without adequate amounts of cholesterol, your brain doesn't work, your hormones don't work, your nervous system can't function the way it's supposed to, you can't heal properly, and so forth. Yep, that's right, you can't. So, this triglyceride, these heavy fats that show up in the body, are directly related to a couple things. They're directly related to carbohydrates, blood sugars, and stress. And so there's an obvious connection that we've known about for a long time as it relates to carbohydrate diets and triglycerides. And, your protective fats, the things that they call the good guys, the HDLs, they're actually lipoproteins, by the way, just for your knowledge. So I was, taken back by all this nonsense. And when I realized that people were being duped, I went on this rampage, if you will, my own billy pulpit, telling people, don't worry about fats. You need fats. It doesn't make any sense not to. Every animal that you look at, any animal that eats meat, any animal that is thriving and has strength and has power and has capacity eats fat. That's one of the first things that they get into their system. So as you go through and you begin to look at the studies all over the place, you realize that the connection is not about eating fats, but it's about the sugars and the carbohydrates that we put into our body that raises these guys up. particularly the triglycerides. So when you're eating tons of carbohydrate and you're eating sugars, particularly fructose, and it's put into everything today, that subsequently it's going to go through the ceiling. Corn oil, by the way, is purported to drop cholesterol. The problem is that it causes damage, and you don't want your cholesterol to get too low. Cholesterol gets too low, you increase your risk of all kinds of things, and by the way, including cancer. And you need to really go online and look at things like the relationship between fats and heart disease. And most people, except for the trans fats, are going to tell you need to have things like olive oil. You're going to need to have things like coconut oil. You need to have things in your diet that protect the nervous system, protect your body across the board. Fat decreases inflammation. See, the reason that you plaque is not because of fat. It's because of the inflammatory levels that are within the body. So if your inflammation is too high, your body's going to protect you by trying to put fat into it. And it's going to put calcium into it to keep it. Remember, we don't want to be acidic. We want to be alkaline. So that's the deal. There's an article that was out there, actually, and as a result of a study, and I'm going to give you the name of it so you can go look at it. It's called How Bad Science and Big Business Created the Obesity Epidemic. After you get done reading that, you're going to be taken back a little bit, and then that's a conversation that we can have across the board on a different level with completely. Hillary, how can I help you? Hello?
Hello?
Hi. Are you there?
Yes.
How can I help you? This is Dr. Tom. Hello?
Yes.
What's your question?
Oh, my question is I just had a bone density test done for the first time. I turned 61 actually, and the doctor said they found a lesion on one of my bones, and they're sending me back for a bone scan. She also mentioned that these are often cancerous. Can you tell me what a lesion is? I have no clue. When I heard the word cancer, my mind turned off.
Okay, I got it. And it scared you to death. I totally appreciate that. And at first I need to apologize to you because on my screen your name was wrong, but it's Holly, correct?
Right.
Okay. So, Holly, listen, here's the deal. A lesion is any kind of a cyst. It can be a tumor. It can be something that's very, very benign. It could be something that is problematic. It could be a fracture within the bone itself. So you have multiple things. There's an old saying when you hear hoofbeats, look for horses, not zebras. Look for the thing that's the most common. Unless the testing comes back and says that you have a malignancy or something of that nature, at this point, just take a deep breath of air. So what you need to do is you need to find out what you're actually dealing with, and then there are specific channels that you need to follow through at that level. There are people who combine traditional care and allopathic care. There are people that only do allopathic procedures. And then I'll give you, once you find out what this is, if you send me a note, I will give you my opinion, and I'll tell you the playing field, and I'll give you both sides of it. I'll tell you who's out there that does one approach, who does it to the other. At the end of the day, you have to weigh it. But anytime we hear that big casino, the big cancer, everybody gets nervous, everybody gets scared, your brain shuts off, and you say, oh my God, now what? Well, let me tell you this, as long as you're breathing, as long as you have the ability to regenerate cells in your body, as long as you're willing to make changes in your body, there's a tremendous amount of things that can be done to help you. You can go out to, American Cancer Hospitals of America. There's several all over the country. They do combinations of traditional care and natural therapeutics. They have.
Well, I'm a disabled vet, and so I'm getting this care through the Veterans Administration.
Okay, well, that leads you to a different paradigm. Let's do this. Let me know what is going on with you when you get the results, and send me an email at drtomroselle.com. If you'd like to talk to me, I will call you back, and then you and I will have a quiet conversation, and I'll give you my opinion on what's going on.
I'm getting the bone scan next Thursday.
Okay, Holly. Let me know after it's all said and done. We're coming up to a break. We're here at 888-630-9625. We'll have a few more minutes. Love to take your phone calls on any subject that you have in mind. We do this program for you, to turn the lights on for you so you know what you're dealing with and can take the right path for you. Don't go away. We'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle. Listen, Dr. Tom Roselle live on the place on the channel that you are right now, as you do every Sunday, same way. You know what? I started this program many years ago. We've been on the air for decades, and we have brought you the most up-to-date information that we possibly can because you need to know. You need to be your own advocate. Health is a do-it-yourself program. That's why I wrote my book on the same subject. Health is Ageless Health. Health is a do-it-yourself program. Because you need to have a way of kind of walking your way through the weeds and understanding what's being taught out there that isn't necessarily the truth. And if you really take the time and ask the question, who wrote it, what did they have to gain by it, and who funded the writing of whatever it was, research article and so forth. You know, most studies last about a year, maybe two. The long-term outcome of 5 years, 10 years down the line is often set aside. It has to do with everything that is in the marketplace. Take this pill and call me in the morning. That's the attitude. Medicine generally compartmentalized. Now, not across the board, by the way. There are some really good top-shelf medical doctors out there, allopaths, that know their business. And, you know, I go out and I lecture on nutrition and I lecture on neurological applications to the body and acupuncture and all those things to all types of professionals, from allopathic physicians to doctors in naturopathic medicine to osteopaths to chiropractors to acupuncturists and so forth. And, you know, the interesting thing about these folks that are sitting there in front of me is that often they're astounded by the information that I'm giving them, especially when it comes to hormonal interactions and when it comes to fats and things of that nature. And unfortunately, and what I'm going to call this is their educated ignorance, in my experience over time, is not by accident. It's studied carefully. If you find that the medical professionals out there, their ignorance about cholesterol and hormones and so forth is carefully designed, starting over about a century ago, 100 years ago. There was a guy by the name of Flexner, and he came out with this thing called the Flexner Report, and it was funded by the Carnegie and Rockefeller Foundations, and wanted nutritional advice and evidence and so forth to be excised from medical school curriculums. It was, you know, when you read things like this and you really take the time and you go back and you study the historical paths that come about to where we are today and why we have the problems, you think about why we are number 26, 27 out of 35 countries relative to wellness, and we spend 2.5 times more than the next guy down, right? They were successful in getting this done, you know, over the past 100 years. You know, most physicians are then and still nutritionally ignorant. They don't get it. When I have guys who are gastroenterologists who tell my patients that nutrition and what you eat doesn't make a difference. Now, again, there are guys out there who really get it across the board in all professions. But when you hear that nonsense, it makes me crazy anyway on a day-to-day basis. So, you know, if you haven't deduced that, you know, there's a disparity here someplace along the road, that it may be driven by big pharma and money going into the wrong pockets. You know, what doctors are taught in medical school about nutrition is totally wrong in the most situations. And they don't think in systems. They're not taught to think in systems. They're taught they're taught to think compartmentalized symptomological representations. And it's crazy. It makes me nuts. So, when you have Carnegie and Rockefeller foundations that are supporting billions of dollars in application of research, do you think that they have an agenda? Maybe. I'll leave that up to you to decide. I have my own opinion. Obviously, I express it periodically. Don't forget, at the Roselle Center for Healing, we have ongoing in-house continuing education programs just for you every other week. Go to rosellecare.com. And don't forget, Ageless Health 2017, the brain-body connection. Come and meet us. Love to educate you. Love to give you a new lease on your life. This is Dr. Tom Roselle. I'll see you next week. Love you all. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.